Hello, everyone. We're going to wait a couple of seconds for some people to join the line. Great, we'll go ahead and get started. And to everybody on the line, we are also recording this and we'll send you a copy of the conversation here today. But thank you all for joining. Tonight, Joe Biden and Donald Trump will take the stage for the first presidential debate. And let's be very clear, the future of healthcare for millions of Americans hangs in the balance on this final stretch of the election. Today, Democrats are making sure Virginians are on the lookout for the lies and deceit that Donald Trump will try to tell during the debate about his disastrous healthcare record. Since he stepped into office, Trump has repeatedly tried to dismantle the Affordable Care Act, which in Virginia would mean taking away healthcare from 3.5 million Virginians who have pre-existing conditions with no plan to replace it. Even worse, the number may rise quickly soon. If Trump is successful in getting the ACA struck down by the Supreme Court the week after the election, it's likely that insurance companies will treat every American who has contracted COVID-19 thanks to Trump's disastrous response to the pandemic with a pre-existing condition. So today we have a really great group of people to talk about this. We have Senator Mark Warner, Delegate Nancy Guy from Virginia Beach, who has a pre-existing condition herself that she can talk about, Dr. Ebony Hilton from Charlottesville, and Ann Schaup, Communications Director for Protect Our Care. So at this point, I'll turn things over to Senator Warner, and then we will take questions at the end. Senator Warner, the stage is yours.
Well, thank you, Hannah, and I appreciate everybody being on the call today. 35 days from now, Americans and Virginians are going to decide what kind of Commonwealth and what kind of country we want to have. And one of the most important issues I hear, as somebody who's on the ballot as well, is what are we going to do about healthcare? We've seen an epic failure from this administration in terms of preparing a national plan for testing, a national plan for PPE, concerns about politicization of CDC and the FDA. And now we have right at the, in a sense, tip of the spear, the viability of the ACA. The ACA was not perfect by any means, but it did cover 20 million Americans received health care because of the ACA. 3.5 million Virginians, including my daughter, and I know in a moment I'll turn it over to Nancy. Nancy, have pre-existing conditions. The law that protects people with pre-existing conditions is the ACA. So when Donald Trump says he wants to get rid of the ACA, when my opponent says he wants to get rid of the ACA and criticizes me for being the deciding vote, that means you cannot have it both ways. You cannot protect people with pre-existing conditions and not have the market reforms and the framework of the ACA. This has been fact-checked a number of times. Don't take my word for it. Take the American Cancer Society, the American Diabetes Association, the AARP, all who've said the market protections of the ACA protect people with pre-existing conditions, as well as the very important protections of a lifetime cap so that you don't keep paying out of your pocket forever, ever, ever. This whole choice is put in even more relief because this president is trying to rush through a Supreme Court nominee, even though Americans and Virginians are already voting. That is wrong, that is inappropriate, and particularly because literally the week after the election, the Supreme Court will hear the case about the ACA. And if we are jamming through justices that are committed to doing away with the ACA, the protections that we all have come to rely upon will disappear. Are there ways to improve the ACA? Absolutely. Let's roll up our sleeves and find ways to improve this important law, not get rid of it. So with that, let me turn it over to my friend, Nancy Guy, delegate from Virginia Beach, someone who has already made an incredible mark in her first term in the General Assembly, and someone who can speak to this issue from a very personal manner. Nancy?
Thank you, Mark. It's always a pleasure and a privilege to share a podium or a Zoom screen with you. Last year, I unseated a 10-year Republican incumbent, and I ran as marketing myself as part of a firewall against the depredations of an administration that's completely out of touch with what I believe the average Virginian wants. And as I knocked doors back in pre-pandemic times when we could knock doors, the number one issue was always access to affordable health care. It is the tail that wags the dog for every average Virginian, indeed every average American, whether it is a student getting out of college trying to get their first job, or whether it's seniors who at the other end are thinking about relocating to be closer to children. Over and over and over again, you would hear tales of, well, I would do X, but I can't get health insurance. And that was before the pandemic. The pandemic has only sharpened our focus and made it even more clear that disaster can strike anybody anytime, and access to affordable health care is essential to being able to conduct your life. And as a legislator, I have tried to provide that firewall. Only 2 years ago did we expand Medicaid to 400,000 low-income Virginians. And if the Affordable Care Act is overturned, that coverage is going to go away, because we're in the middle of balancing our budget right now. We're in special session, and the state, without the federal subsidies for Medicaid, will not be able to afford to continue that expanded coverage. So that's 400,000 people that lose it overnight. And then there are the 3.5 million people who the insurance companies aren't going to want to insure anymore. And as everybody said, I'm one of those people. Yes, I am a breast cancer survivor, and my liver was damaged by the drugs that I had to take to conquer that disease. So I have to have regular treatment for that. And these things aren't my fault, you know, and they could happen to anybody. And prior to being elected, I was able to get coverage. It cost me $18,000 a year, but after the end of the ACA and the federal marketplaces, I won't be able to get it at any cost. And there are 3.5 million Virginians like me. We cannot allow our federal government to abdicate its responsibility to protect Americans and indeed Virginians anymore. And we can't allow them to lie about it and say that they will protect us when it's so obvious by their actions that they will not. So now I'm going to hand it over to Ann Schaub from Protect Our Care, who is going to be able to give you the specific statistics and numbers of how this is going to, the catastrophe that's going to befall our Commonwealth if Donald Trump is reelected and his administration succeeds in striking down the Affordable Care Act.
Thank you, Nancy. And thanks so much for having me. It's so important to sound the alarm on this issue. And I'm honored to join the call with Senator Mark Warner, who my organization gets to work with all the time. He's a true healthcare champion, and also other Virginians who are passionate about making sure healthcare, Virginians get the healthcare they need, Delegate Nancy Guy and Dr. Ebony Hilton. With this vacancy on the Supreme Court and the coronavirus ravaging our country, healthcare is on the ballot this year. And President Trump is working hard to spin lies to obscure his disastrous record on healthcare. Even before last week, whenever the Supreme Court vacancy happened, our organization was sounding the alarm on this issue. We've been following the case as it's been working its way up through the court, and it's now before the Supreme Court. And 1 week after the election, there'll be oral arguments before the Supreme Court on this case that, if successful, would completely overturn the Affordable Care Act in the middle of a pandemic, with all of the healthcare and protections that that's afforded in it, and it would completely throw our healthcare system into chaos. And so now our healthcare is, with this vacancy, our healthcare is in even greater peril. The stakes cannot be higher. if Donald Trump is successful, the lawsuit would rip healthcare away from more than 23 million Americans. That's 740,000 Virginians, and remove protections for pre-existing conditions away from 135 million Americans. I think Nancy mentioned it before, that's 3.5 million Virginians with pre-existing conditions. And that's anyone who might have asthma like me to someone who's a cancer survivor like Nancy. And another thing to keep in mind, which I think you'll hear more about later from Dr. Hilton, is that 7 million people, over 7 million people have contracted the coronavirus and recovered, but they're still seeing the lasting impacts. So those people may find themselves having a pre-existing condition, and if Donald Trump is successful in this lawsuit, they would have trouble finding care. I know that we're conditioned to kind of expect the unexpected with Donald Trump, but trust me, as someone who's been following his healthcare agenda for these years, we know what he's going to say tonight. He says the same lies over and over, so don't get fooled. Here's the truth. He has tried to slash funding for Medicare and Medicaid. The price of prescription drugs is skyrocketing, and more Americans are finding themselves uninsured under Trump's presidency. And of course, the biggest lie is for the protections for pre-existing conditions, which he said so often that the Washington Post fact checker gave him a bottomless Pinocchio on it. He is not trying to protect people with pre-existing conditions. And so don't believe him, and his Republican allies in Congress do not believe the hype. They have nothing to replace the Affordable Care Act if it goes away. Any bill that the GOP says supposedly protects people with pre-existing conditions is not worth the paper it's written on. You can't just wave a wand and say pre-existing conditions are now protected. You have to have the policy in the bill to back it up. And so I just want to say, with the national spotlight on the Supreme Court vacancy, the president won't be able to hide behind his healthcare lies anymore. Voters will know that Donald Trump is fighting to take away these protections, and will hold him accountable and his Republican allies in Congress for their healthcare sabotage. At this point in time, Virginia just can't afford to move backwards. Republicans want to take us back to the days when insurance companies can make the rules and Virginians can be denied the coverage that they need. That's why we need healthcare champions like Senator Mark Warner, Delegate Nancy Guy, fighting to protect our healthcare and build on what we've already had and the successes that we have in place, and build on those. So thanks again for having me. And now I would like to turn it over to the amazing Dr. Ebony Hilton.
I thank you so much for that introduction. You know, you're right in saying that this whole idea of healthcare shouldn't even be a debate. I think whenever someone doesn't have a plan, they oftentimes distract and they bring up these things to argue about. And that's what we've seen from Donald Trump for the last 4 years. Every 2 weeks, we're hearing my health insurance policy is going to come out. And it's now been 4 years of waiting. And what we know in this time of pandemic, we don't have time to compromise the securities of having health insurance. We talk often about pre-existing conditions, and I think people need to realize COVID-19 has really shifted what we expect to be the percentage of people presenting with pre-existing conditions within not only the next year, but for the next decades, because this virus is causing people to have long-term impacts. So oftentimes we quote the mortality rate, and yes, in the United States right now, we're estimating about 4% of those who have at least gone through the incomplete active stages have passed away, which means that 96% of those persons are now considered recovered. But in that recovered group, we have people like we've had here at the University of Virginia that have had massive strokes. They've had massive heart attacks. We're talking about young people who are now with dialysis requirements, young people who are now with permanent oxygen requirements. We hear these stories, and I think oftentimes because of the narrative that's being pushed by the Republican Party, is that, oh, this is just an old person's disease, but it's not. And I think, and I want to urge young people to truly get involved and start taking note of what is at risk. If we lose the Supreme Court seat, if we lose the ACA, what does that mean for the longevity of your life? Currently, if we're looking at who's actually being more so impacted and the rate of rise of impact, it really is our children. And the ACA right now allows for coverage up to age of 26 under your parents' healthcare insurance, right? And at this point over the summer, we've had an increase of 720% of cases to children, We've had an increase in 356% of hospitalization for children, with 1 in every 3 of those hospitalizations requiring the ICU. And what will that do? When those children are now in the ICU, that means that end organs, their heart, their lungs, their kidneys are not working properly. And we're trying our best on the medical side of things to keep that person alive. But if that child is now 11, what would that child's heart, lungs, kidneys, what would they look like when they're 18? And we are starting to compromise, like I said, this system of which they can still seek that help to keep them alive, to have the fullest life possible. So this isn't a time to compromise. We have a lot of work to do. We just globally crossed our millionth person who has passed away from this virus. And unfortunately, in the United States, we haven't finished with our first wave because of the failed practices that have been under the reign of Donald Trump. We haven't allowed ourselves to have a chance to exhale. So we need to focus. We need to put people in place who actually have a plan and not a distraction, and do everything we can to keep the ACA, and if not, to expand it. Because what we know is that right now, our nation is in a health crisis, and we can't ignore that.
Thank you, Dr. Hilton, and thank you to all of our speakers today. If anyone is on the line and has a question, you can use a couple of ways to communicate that. You can either raise your hand or you can type it into the Q&A pod at the bottom of the screen. But I think it's very clear that right now, Donald Trump tonight is probably going to tell a lot of lies about his healthcare record. And we know what his healthcare record is, and the speakers today talked about that. We do have a raised hand from Joe Daschle, who I'm going to allow to talk. So let's see if this works. Joe, you should be able to talk now. If you unmute yourself, I believe.
All right, how about now?
Perfect.
All right, perfect. Senator Warner, we do have the debate coming up tonight, and so I was hoping we could hear from you about your expectations, what you hope you might hear from Joe Biden, and just what do you think is at stake with their meeting tonight during the first of the presidential debates?
Well, Joe, I think we're going to see a contrast on healthcare, where Donald Trump has had close to 4 years. We know he wants to repeal the ACA, but he's never come up with a replacement. He keeps talking about a secret healthcare plan. There is no secret healthcare plan. His repeal would mean getting rid of protections with pre-existing conditions. It would mean 23 million Americans losing their healthcare coverage. It would mean 400,000 Virginians who got covered by Medicaid losing that coverage. And I would say my opponent, who has constantly criticized me for being the deciding vote on the ACA, has exactly the same lack of plan as Donald Trump. You can't have it both ways. You can't cherry pick things and say, I want to protect people with pre-existing conditions and then do away with the ACA. Matter of fact, my opponent even said that the expansion of Medicaid was like giving a cookie to a child. Come on, we're talking about healthcare. That's ridiculous. Out of Joe Biden, what I think we're going to hear is not only a defense of the ACA, but I think maybe even bigger than healthcare, Joe, I want to see Joe Biden start to stitch this country back together again. Donald Trump has been about division. It's been about division on race. It's been division on red America versus blue America. It's been on urban versus rural. I think the reason why people are so supportive of Joe Biden is not only his policy goals, but his basic empathy for all fellow Americans. And I think we're all hearkening for that time where we can look at each other as neighbors and friends rather than as political adversaries.
I cut him off. I'm gonna bring him on again. Sorry, Joe.
Sorry, I just wanted to see if anybody else wanted to weigh in again, specifically as it relates to the debate tonight, what you're hoping to hear.
I personally hope to hear that we're actually putting people first over party. It's difficult to be a medical provider You have to have conversations of where you go and you speak to families and you have to say, I'm sorry they didn't make it. That to me, when you're having that conversation, you can care less if that person is a Democrat or a Republican. And at this stage, we have to remember that we're American first, and we've strayed away from that. And particularly when you're looking at a president who he himself has pre-existing conditions, he should empathize with what that means and know that no one signed themselves up to have a pre-existing condition. No one wants to have a pre-existing condition. So why would you penalize someone? And why would you take away a safety net that would allow them to have a longevity of life? And, you know, that's what we were founded on, you know, the pursuit of happiness and this idea of we're better together. And at this time, like I said, whenever children are now being involved and we're having high numbers of kids that are now 500, we're estimating 500,000 children are now COVID positive. What is the impact on their life? They need insurance. They're going to need follow-up care for not only this time of pandemic, but for years to come. How is this going to impact their organs and what does that mean for our country in terms of if you're not a healthy country, you can't thrive economically, you can't remain a world leader. And right now we're seeing ourselves slip. We're no longer given that respect that we used to have because we have a failed leader, and we need to put someone in office that puts people first over his own interest.
I think on the issue of healthcare, what you're going to see is one candidate who has empathy and who actually understands the intricacies of the ACA because he was part of the architect that built it, and he understands both its strengths and its weaknesses. He understands that it's all of a piece, that you can't, as Dr. Hilton said, cherry pick the things that you want to keep in it and discard the rest, and has an actual plan to move forward and build on the signature achievement of President Obama's administration. I think on the other side, at the other podium, you're going to see someone who is going to, as he has for the last year, bluster and fabricate and tell us that he has some grand, wonderful plan that's going to be better and more perfect, but he ain't going to tell you what it is because it doesn't exist, and he doesn't understand the issue. He's never understood the issue. When he got elected in the first place, he said, healthcare is complicated. Who knew? Well, let me tell you, I knew. And I wasn't running for president of the United States, but let me say that Joe Biden absolutely does know. And if allowed to delve into the particulars of the issue, I think you're going to see a very stark contrast between somebody who absolutely understands the problem and understands the solution that has been crafted in the last 10 years and somebody who just doesn't.
Those were incredible answers. I really don't have anything more to add, but I do want to just emphasize, you know, the fact that that 200,000 people have died from the coronavirus in the United States, and we really haven't had any sort of recognition of that or any sort of like public mourning because the president has to hide his record and pretend that that didn't happen because he hasn't fully taken on the virus to address it. And so, you know, I think that we will see the empathy from Joe Biden, where these issues, healthcare is a very personal issue for people. We often are talking about it kind of in the abstract policy, but it's personal. It's about your health. It's about your pocketbook. And I think that Joe Biden understands that. And I don't think the president does. And so I think tonight you will hear, as my fellow panelists have said, you'll hear the empathy from Joe Biden, and I will be really heartened to hear if he can bring it back to the impact on real people, because you know if this case is overturned, this isn't about some just policy. This is going to affect millions of people. It's going to affect people with pre-existing conditions, and it's going to, frankly, even if you have employer coverage and you don't have a pre-existing condition, it's going to throw our whole healthcare system into chaos. And as Dr. Hilton said, it's going to make our economy, it affects all areas, with healthcare. So it's going to impact the economy. It's going to impact our jobs. So I really would like to see that contrast tonight as well, and I think that we will.
Thank you all. I know we have a question from Brendan Ponton, who's from WTKR in Norfolk. So Brendan, you should be able to unmute yourself now.
Yes, good morning. Question for maybe Senator Warner, you might want to just weigh in on this, but with the debate tonight, President Trump has, proposed that Joe Biden needs to take a drug test. Now there's also talk about whether or not they need to be checked for earpieces before the debate. Just what do you think of those tactics?
These are classic Donald Trump attempts to distract people from the issues at hand. It appears to me that he's going to try to throw up as much smoke as possible, because I think most Americans are going to wonder, in light of the news we've heard yesterday, why is Donald Trump, who claims that he is the smartest, richest guy around, not paying any federal taxes? I think he will do anything possible to distract from his failed record and from what appears to be a unwillingness to pay his fair share in terms of contributions to our national security, to law enforcement, to health care, that all Americans have an obligation to pay.
I would actually hope that if he is thinking that Joe Biden has an earpiece, that maybe he can get one too, because he's not listening. He's not listening to experts, right? He's not listening to the medical experts. And if he were listening, then he would know that we're reporting studies of where even for people who have mild to asymptomatic COVID-19, if you look at the University of Pennsylvania, 15 to 30% of their athletes who had barely any symptoms or no symptoms at all with COVID-19, when we scanned their heart, they had inflammation of the heart. These are young people. There's a study out of Germany where out of 100 people who, again, had mild to no symptoms at all, but tested positive for COVID-19, 78% of them had inflammation of their heart. And what does that do in 5-10 years, where we see development of heart failure symptoms in people in their early 30s to mid 40s, when we used to not see those until you're later into your ages of life and into retirement, right? What does that mean? And so if I would recommend to Donald Trump, wear an earpiece, wear earpiece daily, and start listening to people who know more than you. Because at this stage, that arrogance and that refusal to take advice from the leading experts in those task forces is costing American lives. And at this point, we know that we are at least saying close to 210,000 that we've confirmed. But if you look at our estimated mortality, we are far beyond that. I mean, we probably have upwards of 100,000 people that are unaccounted for who have passed away, right? And we can only assume in that number, when we had the failure to actually start to test by 12 weeks delay from this politicization that he wanted to pull, that those people were likely COVID positive too. And by the end of December, we're estimating another 200,000 people will lose their lives to COVID-19. It's disheartening, to say the least, because like I said, we, the medical providers, we are the ones that have to go out and tell these families, I'm sorry, they didn't make it. And it's not a joking matter. He needs to start taking the advice and doing his job, or step aside.
And I know Senator Warner might have to run. So Senator Warner, if you have to hop off, we can definitely do that.
I just want to.
Yep.
I want to chime in, Brendan, and say that if there's a drug out there that can make Donald Trump knowledgeable, as empathetic, and as honest as Joe Biden, I wish to heaven he'd take it.
Right.
I just want to say this again. In Virginia, we have a tendency to say, since we have elections every year, this is the most important year. This year clearly is the most important year. It's what we've talked about healthcare today. We've not touched on election security. We've not touched about how we're going to make sure that people who've lost their jobs from COVID are going to get the training and skills they need to get back. I think it's remarkable to me that we've not put together another COVID relief package because the White House has been unwilling to negotiate. So again, people will get a chance to view a contrast between Joe Biden and Donald Trump. But I so strongly urge all my fellow Virginians, get out, make sure your voice is heard, and you can early vote in Virginia. I've already early voted 9 to 5, every community. Go to iwillvote.com and you can find where you can vote. Thank you, Hannah. I'm sorry about having to sign off.
You probably have a lot of other things to do. Thank you for joining us. I want to let anybody else answer Brennan's question, either Delegate Guy or Anne, if you wanted to weigh in on either of those things.
I think it was answered beautifully.
Great. Well then, it looks like we're going to wrap up now. Thank you to everyone for joining. Senator Warner, Delegate Guy, Dr. Hilton, and Anne. Thank you so much. Clearly, healthcare is on the ballot, and we're going to see tonight Donald Trump trying to dodge those questions, but I hope we're putting Virginians on notice that they should be looking out for those lies tonight. So thank you everyone for joining, and to the reporters on the call, I will be sending you all recordings of this conversation, and feel free to reach out to me at hannah@vademocrats.org if you need anything else from any of our panelists. Thanks everyone.
Yeah.